Hi, I'm Dr. Alex Ye, and welcome to part 2 of the Smile Makeover video. In part 1, you saw the preparation of 8 teeth for porcelain veneers and or crowns, and in part 2, we're going to be cementing these porcelain restorations that have been fabricated in my lab, completing the Smile Makeover for this patient. I hope you enjoy the video. These are the porcelain restorations that have come back from the lab. As you can see, they're on a model. We placed them on the model just to make sure everything fits and how they look on the model before we try them in the mouth. I'm going to obviously freeze the patient because we're going to be cutting off her temporary restorations, and without freezing, there would be quite a bit of discomfort. The teeth are still vital, or many of the teeth are still vital and require freezing. So the temporary restoration is a single unit. All the crowns or the temporary crowns are all splinted together for retention and durability during the 2 weeks that she had them on. So we don't want those to obviously break off when she's using them to eat or she's talking and have an embarrassing situation where she loses the temporary crowns. So here I'm just clearing the interproximal spaces between each of the crowns, the temporary crowns, and then I'm cutting a small slot in the middle of the tooth so that we can use that as a purchase point with a scaler to just remove the acrylic there. So that's what we're doing right there. You'll see these dark lines, these dark stains on her teeth. The patient is a smoker, and I find that patients are smokers, especially smokers, or if they drink a lot of red wine or tea or coffee, you get that staining where the stain just kind of leaks under the temporary restorations. This is definitely not a problem with the permanent restorations because they're permanently cemented and there's no leakage, no possibility of leakage because they're sealed. But it does present an issue in the under the temporary crowns because we do have to clean that stain off. Because it will show through the translucent areas of the porcelain. So we don't want that, obviously. So I'm using just like a fine diamond just to clean off the stain. That's what you're seeing here. Stain is fairly tenacious, but not really that much of a problem cleaning off. So we're replacing the porcelain restorations now. And so we're going in an order that starts with the central incisors and we move outward. Lateral incisor, canine, and then premolar. That's the premolar, which is the crown. The other teeth are 3/4 crowns or veneers. Like it's, I don't, as I mentioned in part 1, I don't typically prep teeth for traditional single surface veneers. So obviously there's still cotton rolls in her lip, that's why her lip is riding high like that. But we're just making sure the patient's pleased with the results and she's happy with the way they look and the way the symmetry is. So I'm just kind of pointing out some details that the patient may not see right away. And I'm also looking very closely to make sure I'm happy with the results as well, which I am. We didn't catch this on camera, but the first time we tried those on, the patient's reaction was much more animated. She was quite happy, quite pleased, and excited to get these porcelain restorations on. So now we're preparing the porcelain surface for bonding, which involves an acidic etch and silinating agent as well as a bonding agent. So right now we've skipped ahead to the bonding agent. So we're using the Excite porcelain bonding system, which is an Ivoclar product. Sorry, the Excite is the bonding and Variolink is the name of the cement. So I'm just pointing out the order of cementation to my assistant. So we're placing an isolation device so that you know, we keep her lips and cheeks out of the way. So this blue etch here is the same etch we use for teeth when we do fillings or we're doing any kind of adhesive dentistry with composite. So I'm going to make sure we get the margins as well as all of the bonded surfaces, and then we're going to carefully rinse that off with a high volume suction in place. And so she's well frozen right now, so she's not feeling anything. And as you can see, those are the prepared teeth. And right now we are applying the bonding agent onto all the teeth. Air thinning it. And we're going to light cure all of those. While I'm doing that, my assistant is loading the cement, the resin cement, and I am placing the restorations, starting with the central incisors and then moving back to the laterals and the canines and the premolar. So we have to do this relatively quickly because the cement, although is light cure cement, you still want to make sure that you do this relatively quickly. You don't want any gingival bleeding contaminating the seal or the bond. Okay, so we've got all of the units in place. I'm going to make sure they're all seated well, and then we're going to spot cure. We're going to light cure the restoration so that the cement is cured. And then before we fully cure it, I'm going to use the floss to just make sure we can floss between the teeth. There's sometimes going to be too much cement between the teeth and proximally that the floss doesn't fit through, and then we'll deal with that later after we fully cure the restorations. And so you'll see we're using 2 curing lights at the same time just to be efficient. My assistant is holding one, I'm holding the other. And then we're going to refloss. I'll use a scaler just to scale out any excess cement or bonding agent. We're making sure that there's no excess cement, obviously. Give it a quick wipe with the gauze just to make sure there's no little bits of debris. Double check with the scaler. Okay, now we're checking the patient's bite and making sure their occlusion is good. She had a anterior open bite to begin with and couldn't occlude on her front teeth unless she slid her lower jaw, her mandible, forward by quite a bit. So she's still frozen, so her lip is still drooping from the freezing. Obviously she won't thumbs up. So that was our video. I hope you enjoyed it. I know our patient was very pleased with her results. If you or anyone you know is interested in cosmetic dentistry or smile makeovers, please give us a call or visit us at smilesdentalgroup.com. All our cosmetic consultations are free of charge. So hope to see you soon.